Even if we accept all of the economic and moral reasons for providing affordable coverage to all Americans, there's no denying that expanding coverage will come at a cost, at least in the short run. But it is a cost that will not, I repeat, will not add to our deficits. I've set down a rule for my staff, for my team, and I've said this to Congress. Healthcare reform must be and will be deficit neutral in the next decade. Now, there are already voices saying the numbers don't add up. They're wrong. Here's why. Making healthcare affordable for all Americans will cost somewhere on the order of $1 trillion over the next 10 years. That's real money, even in Washington. But remember, that's less than we are projected to have spent on the war in Iraq. And also remember, failing to reform our healthcare system in a way that genuinely reduces cost growth will cost us trillions of dollars more in lost economic growth and lower wages. That said, let me explain how we will cover the price tag. First, as part of the budget that was passed a few months ago, we put aside $635 billion over 10 years in what we're calling a health reserve fund. Over half of that amount, more than $300 billion, will come from raising revenue by doing things like modestly limiting the tax deductions the wealthiest Americans can take to the same level that it was at the end of the Reagan years, same level that it was under Ronald Reagan. And some are concerned that this will dramatically reduce charitable giving, for example, but statistics show that's not true. And the best thing for our charities is the stronger economy that we will build with healthcare reform. But we can't just raise revenues. We're also going to have to make spending cuts, in part by examining inefficiencies in our current Medicare program. There are going to be robust debates about where these cuts should be made. I welcome that debate. But here's where I think these cuts should be made. First, we should end overpayments to Medicare Advantage. Today, we're paying Medicare Advantage plans much more than we pay for traditional Medicare services. Now, this is a great deal for insurance companies. It's a subsidy to insurance companies. It's not a good deal for you. It's not a good deal for the American people. And by the way, it doesn't follow free market principles for those who are always talking about free market principles. That's why we need to introduce competitive bidding into the Medicare Advantage program, a program under which private insurance companies are offering Medicare coverage. That alone will save $177 billion over the next decade. Just that one step. Second, we need to use Medicare reimbursements to reduce preventable hospital readmissions. Right now, almost 20% of Medicare patients discharged from hospitals are readmitted within a month, often because they're not getting the comprehensive care that they need. This puts people at risk. It drives up costs. By changing how Medicare reimburses hospitals, we can discourage them from acting in a way that boosts profits but drives up costs for everybody else. That will save us $25 billion over the next decade. Third, we need to introduce generic biologic drugs into the marketplace. These are drugs used to treat illnesses like anemia, but right now there is no pathway at the FDA for approving generic versions of these drugs. Creating such a pathway will save us billions of dollars. We can save another roughly $30 billion by getting a better deal for our poorest seniors while asking our well-off seniors to pay a little more for their drugs. So that's the bulk of what's in the Health Reserve Fund. I've also proposed saving another $313 billion in Medicare and Medicaid spending in several other ways. One way is by adjusting Medicare payments to reflect new advances and productivity gains in our economy. Right now, Medicare payments are rising each year by more than they should. These adjustments will create incentives for providers to deliver care more efficiently and save us roughly $109 billion in the process. Another way we can achieve savings is by reducing payments to hospitals for treating uninsured people. I know hospitals rely on these payments now legitimately because of the large number of uninsured patients that they treat. But if we put in a system where people have coverage and the number of uninsured people goes down with our reforms, the amount we pay hospitals to treat uninsured people should go down as well. Reducing these payments gradually as more and more people have coverage will save us over $106 billion. And we'll make sure the difference goes to the hospitals that need it most. We can also save about $75 billion through more efficient purchasing of prescription drugs. And we can save about $1 billion more by rooting out waste, abuse, fraud throughout our healthcare system so that no one's charging more for a service than it's worth or charging a dime for a service that they don't provide. Let me be clear. I'm committed to making these cuts in a way that protects our senior citizens. In fact, these proposals will actually extend the life of the Medicare Trust Fund by 7 years and reduce premiums for Medicare beneficiaries by roughly $43 billion over the next 10 years. And I'm working with AARP to uphold that commitment. Now, for those of you who took out your pencil and paper, altogether, these savings mean that we've put about $950 billion on the table. And that doesn't count some of the long-term savings that we think will come about from reform, from medical IT, for example, or increased investment in prevention. So that stuff in congressional jargon is not scorable. The Congressional Budget Office won't count that as savings. So we're setting that aside. We think that's going to come. But even separate and apart from that, we've put $950 billion on the table, taking us almost all the way to covering the full cost of health care reform. In the weeks and months ahead, I look forward to working with Congress to make up the difference so that health care reform is fully paid for in a real, accountable way. And let me add that this does not count longer-term savings. I just want to repeat that. By insisting that the reforms that we're introducing are deficit neutral over the next decade, and by making the reforms that will help slow the growth rate of healthcare costs over the coming decades, bending the curve, we can look forward to faster economic growth, higher living standards, and falling instead of rising budget deficits. Now, let me just wrap up by saying this. I know people are cynical that whether we can do this or not. I know there will be disagreements about how to proceed in the days ahead. There's probably healthy debate within the AMA. That's good. I also know this. We can't let this moment pass us by.